Hello, my name is Dr Graham Bilbrough and I'm a veterinarian with IDEXX Laboratories. I'm here to talk to you today about preventive care. Preventive care is what we as a profession focus on to minimise disease in the future. It's about detecting and responding to problems as early as possible. Like you, IDEXX is committed to prolonging and improving the quality of life for all our pets. Recently, we wrapped up some research on dogs and cats that attended over 5,000 North American veterinary practices for preventive care. We wanted to use a big data approach to answer the question, how often does a preventive care profile demand follow-up? We built a database of blood results from more than 250,000 dogs and cats where the pet owner had been charged for a wellness profile that included a Chem22, including IDEXX SDMA, and CBC. We analysed each of these profiles looking for significant abnormalities. Remember, we were asking the question, when does the profile demand follow-up? As we were looking at many thousands of profiles, we used a computer program to analyse the profiles using rules defined by IDEXX veterinarians. Your first question is likely to be, what constitutes a significant abnormality? After all, we sometimes see results outside of the reference interval that are not clinically worrisome. For example, a low activity of ALT has no clinical consequence and is usually ignored. Likewise, a result just above a reference interval may not be concerning for that particular patient. The group of IDEXX veterinarians determined new, somewhat wider thresholds. These made it more likely an abnormal result had clinical significance. Effectively, we reduced the noise by eliminating many of these insignificant abnormalities. For haematology, our big data approach limited our ability to capture all the great information in a CBC. We could use the algorithm to find patterns like a stress leukogram or anemia, but we missed important written descriptions of things like the red cell morphology and of immature cells. In an ideal world, we would have had the chance to work up every abnormality we find in a profile. However, we know that many results are vague and non-specific. For example, many veterinarians won't work up a dog where the only abnormality is ALKP, even if it is very high. To build confidence that we're finding something meaningful in the profile, we look for those patients that had at least 3 significant abnormalities across the CBC and Chem22. However, think about the patient with dramatic elevations in just 2 parameters. It wouldn't have been included in our definition. Would it have benefited from a workup? Absolutely. However, the conservative approach we took for the study meant it wouldn't have been included. We were looking for the fraction of profiles where we were confident that they would demand follow-up. For SDMA, where an abnormal result indicates the need for a urinalysis, a single elevation was sufficient for the profile to be included. From over 250,000 wellness consultations where a Chem22, including IDEXX SDMA, and a CBC was used, 1 in 7 adults, 1 in 5 seniors, and 2 in 5 geriatrics had profiles that demanded further consideration or follow-up. We are not saying these patients were diagnosed with an immediately life-threatening disease. We are saying with confidence that these wellness profiles would have led to further consideration or workup for that patient. Clearly, in adults of all ages, adding a chemistry profile, a CBC, and an SDMA to your preventive examinations will change the management for many of those patients. Put the other way, without the wellness visit that included blood testing, important changes would have been missed.